speak when invited. Members of the public are welcome to view the proceedings but should not make contributions at this meeting. All participants should mute their microphones and turn off their video feed when they are not speaking. I think that speeds the process up then. So please remember to unmute your microphone and switch on your video feed when it's your turn to speak. Speak clearly and slowly into your microphone. Anyone wishing to speak should indicate using the raise your hand button on the Microsoft Teams, or if you haven't got that facility, to raise something on the chat facility. I will invite people to speak at the appropriate time. Please I ask for everyone's patience with the use of the technology, and I apologise in advance if we experience any unforeseen difficulties, which we'll try to resolve. I think at the council meeting last Thursday, quite a number of members lost sound halfway through speeches, and we want to try and avoid that. I shall now follow the agenda items. So first of all, apologies for absence.
We received apologies, Chair, from Councillor Ali.
Yes, thank you.
And Matt Boucher has also submitted his apologies.
Thank you. And I've just had a telephone call from Councillor Alan Hopwood. He's been called back into work, and so could we please record his apologies?
Noted, Chair.
Okay, now the appointment of any substitute members.
We have one substitute, Chair, and that's Councillor Carroll, is substitute for Councillor Ali.
Thank you. And agenda item 3, declarations of interest under the Members' Code of Conduct. There are none?
Yes, there are. My hand's up, sorry.
Yes, sorry.
Yeah, I have to declare an interest. My eldest daughter is a senior nurse at Russell's Hall Hospital.
Thank you.
Okay.
Right. Any more declarations of interest?
I always declare this one, Chair. It's Steve also, and that's the I'm the council nominated member on the Council of Governors at Russell's Hall.
Okay, Steve. Thank you. And I always declare this. It's not necessary because it's not financial. As chairman of Dudley Mind, the mental health charity.
Chair, Councillor Neil's raised his hand as well.
Councillor Neil.
Yes, Chair, just through you, just to let you know that obviously the same declarations I normally make, where my wife is on the Board of Governors at Russell's Hall Hospital, and she's just got a job there as well, but I've already declared that.
Thank you, Chris. Thank you. Are there any more declarations of interest? No. I'm going to call the Chief Exec, Kevin O'Keefe, to say a few words now. Kevin.
Yes, thank you, and through you, Chair. I suppose a bit of a helicopter view might be useful in scene setting. So what I would say is that the COVID-19 pandemic has had far-reaching implications for all of the council services and indeed its partner organisations, and a considerable amount of work is still ongoing with the council and its partners doing remarkable things to address the challenges that have been brought about by COVID-19. But as the country emerges from the restrictions,
got this shot. Yeah, please.
It's essential that the lessons that are learned can be utilised to make a difference. And those things that perhaps make a difference are those things that perhaps the committee may wish to focus upon, which are those things which could prevent the occurring of a second spike in Dudley, and looking at things that we can do to reduce its impact if such a second spike arises. And it's all about working together and looking at things that were done well and those things that could be done better. So in my view, that the committee may wish to have a focus and decide how best to scrutinise those key issues effectively. And plainly, there's a genuine commitment from myself, my senior team of officers, cabinet members and councillors right across the board to provide such support as is necessary. And indeed, you'll find, I'm sure, the same from our partner organisations. But it's not for me as Chief Executive, of course, it is for this committee to decide how best they wish to move forward. There are some directions and proposals in the report submitted to ensure proper, appropriate in-depth scrutiny is undertaken. But the key points, if I can draw those out, Chair, are these. That this committee should undertake a full scrutiny review of the response of the Council and partners to the pandemic and use that to form the basis of the Scrutiny Committee's programme for business for the 2020-2021 municipal year. The second point I think to draw out is that as the pandemic is a major public health emergency, it's appropriate that the scrutiny review is coordinated by this committee. This will of course avoid duplication, and this of course was the action agreed by the meeting chairs and vice chairs a little while ago. And the last thing I think really is that of course the chairs and vice chairs of all other scrutiny committees will be given a standing invitation to attend meetings of this committee and contribute to the scrutiny process as appropriate. And indeed, of course, relevant cabinet members, myself, directors and partner organisations will also be issued invitations to attend meetings and make submissions at the appropriate time in the course of your business. Arrangements are being made for the meetings to be scheduled, and proposals are contained within the report. The committee can identify examples of best practice. Of course, you can challenge the lessons that have been learned in delivering services, engage with communities and understand their role in responding to the pandemic, and of course make recommendations to the appropriate decision maker on proposals that can be applied for future service delivery models. And I think the other point I'd make really is this, is that because I think our scrutiny committee is one of the first to take the bull by the horns, as it were, certainly in the region as far as I'm aware, and probably nationally, the lessons that can be learned from the way in which Dudley and our partners have responded to the pandemic might very well be submitted to universities and other seats of learning to inform their academic work as an evidence base and data set going forward. So it is an exciting piece of work. I think it's probably the most exciting piece of work that I've seen that could be presented to any scrutiny committee, certainly in my career. And no doubt it's not just the lessons that can be learned, but the enduring learning from the work that the committee does in the year ahead, working very much in real time. Should there be a second spike, that will add immediate value to your deliberations. I don't think I can assist further, Chair.
Thank you very much, Kevin, and wise words. And I do welcome your support, and I know all the other members of the committee will welcome your support as well. But we do this, and we all do this anyway, not for our own benefit. We're doing it for the health and the well-being of everybody in Dudley, every man, woman and child in Dudley. And this is an exciting time for this committee. It's a very busy time, and we've got a committed set of councillors working, and I'm pleased to say everyone is fully committed to that. And we can only achieve what we can achieve by the commitment of all the people that are around us. It's good to see that our partners are fully bought in to this mechanism too. I was really pleased with the commitment and the contributions made at the last committee meeting. And can I just mention healthcare, Health Watch as well. I know Jane Emery is on board, and at this meeting, it's crucial that Health Watch have a voice, a public voice at this meeting as well. So Jane, I'll be expecting you to chip in occasionally if you can. So thank you, Kevin, and it's good to see that we've been taken seriously because we take ourselves seriously. Thank you very much. Helen, if we can move on now to confirm the minutes of the meeting held on the 10th of June 2020.
Can I have a seconder to say that these are agreed?
Seconded.
Yes, I can do it. Yeah.
Thank you. Thank you. Val, did you want to come in on any of your actions from the previous meeting?
Yes, I've got, there's one action that was regarding circulating the membership of the groups that were attached to Appendix 1. I'll get that information out to you by the end of this week. The other action was around any data we had around expected deaths versus actual deaths, and I have circulated some charts today, and I'm sure that these will obviously be subject to scrutiny as we move forward into the calendar of scrutiny meetings. But just to reassure you that what the data shows is that we did have a peak in deaths, and it sort of coincided with the sort of national lockdown period, and there was quite a peak sort of towards the beginning of June. sorry, at the beginning of April. And then what you'll see is when the advice changed to stay alert, which was around the second week of May, we've since had a very steady sort of situation with the death rate in Dudley. So sadly, as I've said in my previous meetings, it's very sad to hear that we have had so many deaths. But it seems to be that we've fared better than maybe some other areas. And in fact, on average, it seems that since sort of in the second week in May, our level of deaths is sort of in line with what would be expected over these last few months. So hopefully that sort of reassures members that we have been monitoring the data, and there is a STP-wide mortality review group that has been set up to look at this in more detail. So again, I think some of that information will be then shared with you over the course of the future scrutiny meetings.
Thank you, Val. And yeah, one thing that we did say when we set about to do the COVID-19 response in this committee, we had to be very careful not to deflect our officers, our hardworking officers who are on the front line, not to deflect them from their or detract them from their everyday work. And I do know that it's been pretty onerous at most of the time. So I do appreciate all the extra work that we're throwing at you, and you're coming back with the answers we want. We'll be very, very lenient on when we get the stuff, because we do know the pressure you're under. So can I confirm the minutes of? Thank you, Val. Now moving on to agenda item 5, the scrutiny review. Can I just say at this point, the scrutiny review, this is really just to set the scene for where we move into the scrutiny process from now. This gives us the wherewithal to carry out the review from this point onwards. So we have to do things as per the Constitution and do things in stages. We've gone through the chairs and vice chairs. We've come through this meeting now. This report now will set the scene for how we approach COVID-19 scrutiny from this point onwards. So Helen, if you can talk us through that report, please.
Okay, Chair, thank you. The Chief Executive has introduced the majority of the report, but I will just run through what has been sent out to you. So the purpose of tonight's report is for members to consider arrangements and timescales for the scrutiny review and the Council and partner response to the COVID-19 pandemic. I don't intend to go through the whole report. However, I will refer members to paragraph 8, which outlines the proposals and suggested key themes for the scrutiny review. The review is proposed to be undertaken over a series of specially convened meetings on dates and times to be arranged in consultation with the Chair and Vice Chair. Appendix 1, that is also attached to the report, outlines items that have previously been suggested for the committee's work programme. These obviously will now be reviewed in consultation with the Chair, Vice Chair and relevant officers, and will be programmed in for consideration at future scheduled meetings. So the recommendations for tonight's meeting are the proposed approach to the scrutiny review of the response of the Council and the partners to the COVID-19 pandemic be endorsed, and that the lead for law and governance, following consultation with the Chair, Vice Chair and appropriate directors, be authorised to take any necessary action to progress the scrutiny review, and that the lead for law and governance, following consultation with the Chair, Vice Chair and appropriate directors, be authorised to review the items listed in Appendix 1 and to confirm that the future programme of scrutiny business for this committee during the 2021 municipal year. Thank you, Chair.
Thank you, Helen. That just outlines what we intend to do. It's a 5-page report and it's now open to debate. If any members wish to speak, can they raise their hand or indicate through the chat mechanism. Helen, can you outline in order they appear, please?
Yeah, Councillor Elaine Taylor.
Unmute. Okay then. Right, Bal. This is a question for Bal on this on where we're moving forward to. Bal, how much reassurance can you give us that we're ready for the next phase? Although this is just scrutiny, this is just a concern that I have, that we're being told that there's another phase of the COVID-19 coming. How ready are we as a council for the next phase?
Okay, you will be aware that as part of the National Test and Trace programme that's been put in place to try and minimise the spread of COVID as we've sort of eased lockdown, local councils have been asked to prepare outbreak plan, and we're calling outbreak plans. They are our whole strategy to working with, right the way from a prevention perspective and right the way through having managing small outbreaks, be they in care homes or be they in a community setting or a workplace setting. We've got several key areas that we're expected to focus on, and some of these are our sort of key vulnerable areas and hotspots that might be expected, and some of this we're learning as we're moving through the situation. So our outbreak plans had to be assured by the Department of Health and Social Care. Example is, and I have said this before, there's only so much you can test, when things are on paper. The real test is in actually applying those plans. So we are over the next couple of weeks stress testing those plans. So we will be testing out different scenarios and how we would respond. We have been very fortunate in Dudley that we've got very good learning from both the outbreak initially starting in the hospital setting. We know that the hospital is very well prepared, and we also know, working with partners around the care home settings, that we were able to keep 60% of our care homes COVID free. So we know that as partners, we have been able to work in a really strong collaborative way in ensuring that when there has been an outbreak, that we've been able to give the required response and support to prevent the outbreak escalating. What we're seeing now nationally is a slight difference in how those outbreaks are now appearing, and they appear to be more community focused and amongst a younger age group. So it's more the working class, working age sort of work group, and younger, a much younger population. So our plans are sort of continuously being reviewed to adapt to those situations. We've set up a COVID-19 board that is made of key representatives from across the system that are actually assuring that our plans, and that's led by myself. We're developing a triggers mechanism which helps us understand at what point we need to actually escalate and maybe put in place different communication plan strategy, or where maybe we need to put in place our new legislative powers. And then we've also set up a member-led engagement board, and Councillor Barlow chairs that. And I know several of the members have attended the first meeting. And again, we're putting in place plans around really sort of robust communication and engagement plans. So all of this is us preparing for the second wave. And again, all of this isn't done in silos. We are working with our partner agencies, and things like, preparing for the flu vaccination is really important, and from a preventative perspective, and also some of the work around, we've seen over the weekend in the media around obesity and some of the risk factors. Again, it's trying to reduce the risk factors in the population. So there's several different things that we are working working towards to make sure that we are prepared. I think we've been very fortunate actually that we've been probably behind the curve, so there's an opportunity to learn and take learning from other areas. But I do want to say, despite the fact that our cases have been low, we've been averaging 3-4 a week. This weekend was the first weekend we saw a rise in those cases, and I expect that we'll probably continue to see that now. And we all know that there's people going on holidays, and the fact that I think, have I lost you?
Carry on, Bal.
No, carry on.
Sorry, I thought I lost you.
No,
there.
you Bal.
So I think we're aware that there's all of these other situations that we are going to have to manage and deal with. So I think that's the assurance I can give you, that we are doing our best to work with all the key partners, regional Public Health England teams. So, for example, over the last few weeks, it became known to us that there were a number of cases that were in Dudley that were linked to an outbreak outside of the borough. So I've actually personally got involved in that outbreak management meeting to make sure that we were also cited on the public health actions that were being taken, and we were also making sure that our workforce, that live in this borough, working over the border, were also getting the relevant public health advice and guidance and preventing any further spread. So I'm hopeful that will reassure you. We have got the outbreak report on the website, and we are going to continue to add to that website so that it gives the public confidence on what work we're doing in the council and across the partnership.
Thank you, Bal. I've got 2 speakers.
Thank you.
I'll deal with this, Helen. Thank you, Elaine. I've got Councillor Peter Miller, but Kevin O'Keefe, I suspect you may want to add to what Bal's just said first.
Indeed, Chair, you've read my mind. Just one piece really. It's to add on to what Bal has mentioned at the end there, and that's of course the fact that I suppose if you were to look from the air at somewhere like Cannock, you'd see a conurbation surrounded by green fields. Obviously, in the West Midland conurbation, Sandwell spills into Dudley, and Sandwell spills into Birmingham, and Dudley spills into Wolverhampton, and so forth. So that sort of cross-border working, as it were, that Bal's alluded to, that she's been sort of assisting Sandwell, where there's been an outbreak in 2 locations, and Bal will correct me if I'm wrong. I think 5 people who are resident of Dudley were affected because their workplace was in Sandwell. So even though there was no outbreak in Dudley, it doesn't mean to say that we wouldn't have people affected by that outbreak within our midst in the borough. So what's been happening at a regional level, and obviously we've looked at what we're doing within Dudley, we looked at what we're doing with our partners, and obviously Public Health England is very closely linked into BAL. But just for the committee to be aware, there's a resource that's been deployed regionally, and that's my colleague Clive Wright, the former Chief Executive at Shropshire County Council. Clive's been doing a piece of work right across the region with Solihull, Birmingham, Coventry, ourselves, Sandwell, Walsall and Wolverhampton, to ensure that our outbreak plans have a certain degree of commonality and a certain degree of robustness, so that if there is a cross-border issue, as it were, with an outbreak in one borough and that affects other boroughs or a city, that there is a robust method for common communications to be put out across the piece. Thank you, Chair.
Thank you, Kevin. Councillor Peter Miller.
Yeah, thank you, Chairman. I worry a little bit if we're doing this a bit too early to try and scrutinise it. We don't know a great deal about COVID-19, where it exactly comes from, how it spreads, etc. There's the BAME situation where Asian people tend to be more likely to get it than others. Now, what's the reason for that? People, is it poverty? Is it because they live more in?
Councillor Miller,
Peter,
sorry.
You're muted, Peter.
All right.
That's it.
How much did you hear or none of it?
Most of it.
And so that's the only worry that I have, that is it a little bit too early? Because if you're doing things while they're going on, are you just having a reacting?
Thanks for the question, Peter. Kevin O'Keefe, you've put your hand up again.
Sorry, Chair, that's an old hand. It should have been down. But can I just draw your attention to the fact, Chair, that Councillor Kathy Baton's indicated in the chat bar she'd like to speak.
Right, thank you. Peter, we'll come back to you on that. Kathy, do you want to speak now?
Thanks, Chair. So looking through the papers and the programme of meetings under consideration, along with all the topics that we've outlined, I do think it would be helpful to, for each session that we have some golden threads that run through these sessions. So for me, there should be a focus on every session around communication. And when I say communication, I'm talking about all strands of communication at all levels. So communication with the public, communication with our own internal staff, communication through the media, how we have dealt with communications throughout the crisis. And also, I think the thing about preparedness, I think we should be picking that up through every session as well. So as we go through each session, it is about each part of the council's preparedness for the next phase. And I think it would help if we just kind of kept that in mind when we're scrutinising and questioning. But if I could just comment on Councillor Miller's point, for me, I think the only way that we get good assurance that actually we've learnt some lessons, that we are looking at being prepared for however this pandemic may play out over the coming months and coming years until we have some sort of vaccine. I think for me, it's absolutely the right time to start to look at the council's response, to start to look at how, what as I say, what lessons we've learned and how we're then going to do things differently for the next phase, because no council will have got it right this time. It's impossible. So everybody has got lessons to learn, and I think this is absolutely the right time to start thinking about how we implement those lessons learned and how we do things differently. Thank you.
Thank you, Kathy. Just to come back on Peter's point, it should be reassuring to all of us as members that the minute this pandemic hit Dudley, our officers, every single one of our officers, in particular the senior management staff, started to scrutinise every single aspect of what they were doing from day one. What we're doing is actually pulling all that together as elected members to make sure that everything that they've done and everything that we're doing is done in a timely manner. It would be little point in doing this if we waited until after phase 2, because there are lessons to be learned from phase 1, and then whatever we do, we can build into the response for phase 2. So I think the timing is actually perfect as far as that's concerned. So all I could ask is that everybody joins in with us. Stephen Lonsdale, I think you've put your hand up.
Thank you, Chair. Just to pick up on Councillor Bateman's position around communication, Chair, I absolutely agree with her position and the stance that she's taken, to the point where we have learned lessons and we're also teaching. Dudley and the partnership gave a symposium for Chester University on Thursday of last week to share the lessons that we've learned already and the way that we've managed this crisis situation. And I think that's something that we can be really proud of, Chair, and moving forward again reflect on the position we took at the time we took it and the outcomes that we managed to achieve. Thanks, Chair.
Thank you, Stephen. Who's next? we've got Jackie Cowell, Councillor Jackie Cowell.
Thanks, Chair. First of all, perhaps I ought to, it has occurred to me as this is my first meeting, maybe I should have actually declared an interest earlier on, in the sense that as a member of the shielding group, I have had some support in terms of the government package, just to bear that in mind. And it's partly to do with that. For those that are really, really acutely vulnerable, I just wanted some assurance that those, as we now come out of shielding, is there a specific sort of focus on that aspect at the moment, and those who perhaps who will struggle to adjust between the shielding, if you like, coming out and going back to normal sort of routines? Is there some sort of structure there behind the scenes, please?
Can an officer pick that? Can an officer pick that up?
Do you want me to pick that up, Chair?
Yes, please, Val.
Yes. So we, as part of the outbreak plans going forward, we obviously recognise how important it is that we make sure that our shielded population continue to get the support they need. Yes, we will continue to have the support available, but I would really welcome your contribution to how we could maybe help the people that are shielded, to help in terms of messaging and supporting them, because ideally, as cases start to rise, you know, there's some things that are going to be very difficult for us to manage, but if we can at least protect people on the shielded programme, you know, that's going to be one way of actually reducing the impact of COVID-19. So I'd really appreciate maybe a conversation on how we can work with you to get some ideas.
Yeah, happy to do that. I've had some engagement with some of your officers previously, but I'm more than happy to do that.
Okay, brilliant.
Chair, we've got councillors Chris Neal and Steve Wolfo indicating to speak.
Thank you, Helen. We'll take them in that order then, please. Chris Neal.
Just for yourself, really. I just wanted to really say I agree with Councillor Baton and yourself, Chair, and Stephen. I think it's our job to make sure that everything we have done so far, we learn from, both rightly and wrongly, to go forward, to see what factors we can introduce with new ideas, to learn from what we've already done, like I say, right and wrong, and make sure we implement new things going forward to make sure we are ready for the second outbreak.
Thank you, Chris. Steve, you wanted to come in?
Yeah, thanks very much, Chair. From a very much a layman's perspective, working from on the front line with the food bank and volunteering at the hospital, I think it's absolutely crucial. You're absolutely right. We've got to learn from phase one, so it is the right time to raise these issues. And also, Kathy, with communications, we've got Health Watch on this, representing on this committee through Jane, which is absolutely brilliant. I don't know what other connections we've got, if you like, from the community into this process. DCVS, very crucial people. I don't see them represented on this committee anywhere. And also, and that will then work with the PPE kind of coordination. The volunteers at Russell's Hall Hospital, they've been making PPE. I've been out there with another hat on, witnessing a colleague working through DCVS that have got PPE, it seems, all over the place. But I'm not sure there's a big coordinated effort for these issues. And I think that's something we should look at, the kind of strategic setup of these issues. Thank you.
Thank you, Steve. Of course, it is. It's part of the work programme. I think it comes on meeting one, all to do with PPE, and I would envisage DCVS as being a crucial part of that by coming to appear as witnesses in front of the Scrutiny Committee. There are certain things within the long-term aims of the Scrutiny Committee that DCVS might not be have an impact on, but of course Jane can always have that feedback as a member of Health Watch and working for DCVS as well. So Jane, do you want to come in, please?
Chair, Jane and Councillor Baton also wants to come back into the conversation.
Jane Emery first, then Councillor Cathy Baton.
Thank you, Chair. So yeah, just really wanted to add to that. So obviously from a Health Watch perspective, really encouraged to see how we involve communities throughout this whole process. Also been part of Dudley CVS, so we've been supporting out on the front line with medication collections and shopping to lots and lots of people. We're about to start a survey and some dialogue with people that have actually received support, especially some of those that are still shielded at the moment, as we withdraw some of those services about what are the anxieties, what are the concerns, how do we still support these people, or how can we signpost them to other organisations that can. So I think there will definitely be some learning from that from CVS and us as a local Health Watch. So I'm happy as well to feedback from a Dudley CVS perspective, and obviously throughout the process when it's appropriate for Andy Gray or Kate Green or other colleagues to come and join that process. Thank you.
Thank you, Jane. You sounded like a dog towards the end there.
I have a puppy that's just started to cry as I was about to talk. I was got my fingers crossed that she was going to be quiet throughout the whole process, but she let me down in the last few seconds.
Never mind. I knew it wasn't you. All right. Councillor Cathy Baton next, please.
To be fair, I think Jane covered it. It was just really to echo Councillor Waltho that I really do think we need DCVS representation. Having had some very early conversations with Andy Gray around food distribution and coordination, they'd certainly have an awful lot to offer, and I think it would be really useful for them to pick up around the food distribution issues for those children who were entitled to free school meals, for whom accessing the school vouchers at the outset was very problematic. Thank you.
Thank you, Cathy. Are there any other members of the committee who wish to speak?
Chair, Bal has indicated to speak.
Over to you, Bal, please.
Yeah, I thought I had my hand up earlier, but so I'm just sort of picking back up on the, why it's so important that we actually start the process sooner than later. And I think again, from an officer perspective, that we have been to some extent firefighting, and it has been, the sort of, normally we would want to engage and, collaborate and do a lot more work with our communities and citizens, if we were developing a piece of work. So I think, again, I would really welcome the opportunity, because, sometimes you're just so close to something that you may not see where maybe there are opportunities to learn and do things differently as well going forward.
Thank you, Bal. Are there any other words from any member of the committee or any other senior officer?
Chair, Councillor Elaine Taylor's raised her hand.
Councillor Taylor.
Bal, I'd just like to offer services to Bal alongside Jackie. I was one of the people that were shielded and still are shielding. And I think there's a piece of work that we could do there to help other members of the community. So yes, I'll work alongside Jackie with Bal on that, please.
Thank you. Much appreciated.
Okay. Is there anyone else on this meeting who's not a member of the committee, an invited guest, who wants to say or add or mention anything at all?
There's nothing showing, Chair.
No. Okay. Right. Well, we've got the report in front of us. It's agenda item 5. We've gone through it and we've raised a few quite valid points on that. You'll see from the amount of meetings that we've got, just 4 it says at the moment, but we've got to make decisions at some point whether all of those meetings are 6 p.m. meetings, or whether we're in a position, because of the makeup of the guests that we're going to ask to appear, as witnesses, whether it's in everyone's interest to hold meetings at a variety of times. It might be that a morning or an afternoon meeting. Now, I know that might throw somebody who's on the council, members in particular, that we've always had meetings at 6 o'clock, but we have to bear in mind that a lot of the people can only get an hour during the daytime off their daytime work to appear at meetings like this. And it is fortunate that a lot of this is remote, because a lot of the time constraints for 6 p.m. meetings would constrain them even further. So can I just go on to recommendations, that we accept recommendations 2 and 3, and also utilise, if we can, on the committee notes as well, the golden thread that Councillor Cathy Baton put forward. That, I think that's critical, really, and it's talking to Cathy, that's what they do at West Midlands mayoral level. The golden thread running through all of their scrutiny is communications. Communications at every level. So it's not just CAPA, it's how we communicate with the private care homes, with the local businesses, with everyday residents who might want to help. So is that agreed? We can have those recommendations then?
Yes, Chair.
Yes, Chair.
Thank you.
Yeah.
I've heard no one shout no, so I'll take that as a yes. Are there any questions under Procedure Rule 11.8?
None, Chair.
Thank you, Helen. Thanks, everybody. It's a short scene-setting meeting tonight. Thank you all for your commitment in pushing this forward. This is probably the most exciting scrutiny committee there's ever been on Dudley Council. But I'm looking forward to it, and I hope you're looking forward to it as well. For all the chairs and vice chairs of the other committees, we look forward to hearing what your recommendations to this committee would be, what you want to scrutinise. So please get in touch with us. And we also want you to take part in particular parts of the scrutiny process which relate to your committee as well. Thank you all for coming, and I hereby close the meeting.
Thank you, Chair. Good evening, all.
Thank you.
Thank you.
Thank you.
Thank you, Chair. Bye.
Thank you.
Bye.
Thank you, Chair.
Yeah.
Thanks, everybody.
Dave, I've just put a
Yes,
I've just put a comment in the chat box about just making sure papers come out well in advance of the meetings, because if they're going to be quite hefty,
yeah,
we're going to need that. We're going to need plenty of time.
yes, that's fair comment.
All
Okay,
right.
I've noted that, Councillor.
Thank you. Thanks, Helen.
All right. I
Take
think
care,
I think the later one today was just because you picked it up earlier on.
No, yeah, I mean, I know they usually do come out in time, but I'm just looking at if the plan for meeting 2, there's sort of 3 really hefty items there.
Yeah.
So it would take a bit of digesting, I think.
Well, I think that's going to be a moving feast anyway, isn't it?
Yeah.
Helen, could we just stop the recording, please? Sorry.
Sorry.